going through some housekeeping issues. So again, welcome everyone. Happy Monday. Hopefully you're having a good start to your week. Again, Edgar Villarreal here, your chair for the VA section of Division 18. Really excited, back by popular demand, to have Dr. Malinda Trujillo focus on mental health treatment with Latinx clients and culturally and affirming and responsive treatment. So for those of you that aren't aware of Dr. Trujillo and her work, she is bicultural, Latinx, and wide bilingual Spanish-English speaking psychologist. Her preferred pronouns are she, her, and hers. She received her doctorate from Colorado State University in 2008 after completing her pre-doctoral internship at the Greater Los Angeles VA Ambulatory Care Center. After receiving her degree, she completed her postdoctoral training in PTSD at North Florida South Georgia Veterans Healthcare System in 2009. Dr. Trujillo joined the VA Portland Healthcare System in 2009, where she is currently a staff psychologist for the Vancouver Mental Health team. Her areas of specialization include trauma anxiety, multicultural counseling, Latinx psychology, race-based stress and trauma, and resiliency and empowerment. She serves on the National VA Psychology Training Council's Multicultural and Diversity Committee and VA Race-Based Trauma Consultation Team. In addition to working, Dr. Trujillo provides didactic training, consultation, and advocacy work in the fields of diversity and inclusion and trauma. So Dr. Trujillo, it sounds like you're doing some really, really important work. And as always, love having you on here. And thank you for sharing your expertise with our VA section members. So I'm going to hand it over to you.
All right, thank you all for having me. So they shared a little bit about my background. I always like to start off by sharing my positionality and a little bit about my intersectionality. So I am Mexican-American and Euro-American, Swedish, and Danish, and my family hails from the Southwest, generations of farmers from New Mexico until my generation. And so the topics of Latinx psychology and Latinx mental health has always been near and dear to my heart, even before I knew it was. So that's just a little bit about my background. And what I want to start off by talking about is, why is this important? Why is it important to talk about this topic? Latinxs are the largest and fastest growing ethnically diverse population in the United States. They are the fastest growing in minority population in the US military. And as of the 2019 US Census, over 60.6 million Latinxs are living in the United States, which is making up nearly 20% of the population. Despite the continued growth of the Latinx community within the United States, Latinos, Latinx folks continue to experience systemic oppression in terms of housing, socioeconomic status, education, access to medical and mental health care, and utilization of these services. They contend with ongoing and past oppression, racism, and marginalization. And because of this, this can lead to a general distrust of the medical system because of past injustices. Latinxs continue to be a target of both overt and covert racism. Some examples are the betrayal of immigration of Latinxs. We've all seen that very recently, Latinxs being in cages at the border, being criminalized within our own political system, constantly being compared with words such as criminals or a threat to our nation's security. In many states where there are large groups of Latinx folks, they've tried to pass English-only laws, and what that means is within educational systems, in some states, they've made it illegal for teachers to teach in any language outside of English, which not only affects Latinx folks, but can also affect other ethnically diverse people within our country. They are part of an invisible minority. So like other ethnic minorities within our country, we have been here since the beginning of this country, but often we are erased from history and our contributions are not acknowledged. I took Chicano psychology when I was an undergraduate, and one of my favorite quotes was, I looked at my teacher while raising my mano, if George Washington's my father, why isn't he Chicano? And so oftentimes as people of color, the only thing we hear, if we hear anything about our history within the formal Eurocentric American system in terms of education, is about often about our oppression, very rarely about our contributions, our joy, our history. There's this idea that being Latinx in the United States, it's like we're living life on the hyphen. We're Mexican American, we're Puerto Rican American. There's always this need for somebody besides ourselves to define who we are, where we should be, how we should act, what the rules are, and it can lead to ongoing mental health stressors. A Latinx psychologist has called it living in a perpetual borderland, not just like physiologically, but also emotionally, having to code switch, having to minimize ourselves, having to marginalize ourselves, can lead to ongoing stress. As I mentioned, despite the ongoing growth of the Latinx community within the United States, there continues to be huge disparities regarding S.E.S, education, housing status. That looks like I went backwards instead of forward. Sorry about that. What I want to talk a little bit are the use of terms. And what I want to say is there is no term that everyone accepts within the Latinx community. So the global term Latina, Latino, or Hispanic, they're pan-ethnic labels used to reflect the diversity of origins within the Latinx community. And the geographical areas cross national boundaries. This can include the southwestern and southeastern United States, Mexico, Puerto Rico, Cuba, the Dominican Republic, Central and South America, the Caribbean, and Spain. Originally, the word Hispanic was actually created by the US government as a way to basically do demographics within the census and also provide funding. And so there is some contention among Latinx folks about the use of the word Hispanics. Also, what I want to say is there's also some contention within the Latinx community of the word Latina, Latino, because as you can see, a lot of folks say that Latina, Latino, or Latinx only acknowledges Latin America, but leaves out Caribbean Latinos. And so there are many different terms used, but there are some criticism of all of the above. Oftentimes, folks may define themselves by their family's Latinx origin group. For example, I define myself as Mexican American. I also define myself as Chicano because my father was part of the Mexican American pride movement within the 60s and 70s. And so it's different for different people. So what I always tell people is always err in the side of discussion. Don't make assumptions. Ask people how they identify. For many Latinx folks, race is different than ethnicity. Like I said, we are not the same. Latinxs span the globe, span this country. And so there's often multiracial identity within Latinx communities. So where did the term Latinx come from? It's a pan-ethnic gender-neutral term, which is seen as gender and LGBTQ plus inclusive. So some of you may know, some of you may not know that Spanish is a gendered language. So objects, pronouns are often masculine or feminine. So Latinx was initiated to be more gender inclusive and LGBTQ plus inclusive. It is more commonly used among younger Latinx folks between the ages of 18 and 29, but it is becoming more and more common. So what are some of the shared possible cultural themes within Latinx culture? There's a shared history of Spanish colonization, culture, religion, language, and worldview. There's an experience of uprooting and immigration. Although what I want to say with that is there are some Latinx folks within the United States. Many people may have heard we didn't cross the border crossed us. So for example, my own personal history, my family lived in New Mexico for over 300 years before my generation. And so my family was in the same town, in the same farming community when it was New Spain, Mexico, and then when it became part of the United States after the Mexican-American War. And so oftentimes that's people, I myself, people in my own family have been told to go back to your home or that we're not from here. But many Latinx folks have pan-generational history within the United States, and I think that should be acknowledged. Are you all able to hear me now with my mic? I got feedback in the chat box, hopefully. Okay. As I mentioned, there's ongoing oppression and systemic racism, and which has become more and more overt within the last 10 to 20 years. And also the experience of Latinx immigration is vastly different from European. It's connected to the US expansion and industrial needs. And so when and how we often admit Latinx folks from Latin America or the Caribbean into the United States tends to go with more of a monetary need or a need within our country, and there can be prejudice within that. Just a question, is there still a lot of static for folks, or are folks able to hear me? I'm hearing mics.
I can hear you, Malinda. I sometimes hear some popping in the mic.
Okay.
So I don't know if maybe that's what people are hearing as
Yeah.
static, but you're coming up somewhat clear. I don't know if
I don't have a headset on, but I'm sorry.
That's okay. The closer you scoot to your mic, the clearer we can hear you, and there's less of that popping.
Okay. All right. How is that? Is that any better?
Yes.
Okay, that's about as close as I can get. Okay. All right. Sorry. So what I want to emphasize is that we are not the same. Oftentimes when I am working with clients, I will get comments about my skin tone, about my last name, about my ethnicity. Sometimes as a way of humor, I will say, you know, we're all not Jennifer Lopez, and no, this is no knock to Jennifer Lopez, but she often plays many Latin women, Latina women, Latinx women within movies. We come in all different shapes, colors, shades, languages, from all over the world. And so I just want people to acknowledge that while I'm providing some general background about Latinx culture, Latinx history, that it's not a cookie cutter, and it varies, and we're not a homogenous group, and that you always have to keep that in mind. I think that's true in general when doing work within ethnic minority populations, is that it's good to learn about history, it's good to learn about cultural identification and different cultural themes, but this is by no means a cookbook to work with all Latinx veterans or Latinx clients. But just some general information from the most recent 2019 US Census Bureau as to how people identify. But what I also want to acknowledge is there may be folks who do not participate in the census for fear of retribution, or maybe they're undocumented. So as of 2019, over 61% of folks identified as Mexican or Mexican American, close to 10% identified as Puerto Rican, similar Central America, South America, and other Latinx was about 6%. And that's probably a lot of Caribbean, that's made up of a lot of Caribbean Americans like Dominican, and then 3.9% as Cuban. So I want to talk a little bit about Latinx veterans and their experiences. By the year 2030, there's to be a 23% enrollment in terms of Latinxs serving in the military, but they are disproportionately represented in terms of the population. So making about 18% of the US population, but over 36% of active service members. They also, this was a study done on Latinx males, they have higher rates of psychological injury compared to their white counterparts. And so those are just some of the factors impacting Latinx veterans. Another huge thing is that they're overrepresented in combat positions, as up to 85% in 2014 in a study. And often many of their mental health and medical needs are not met. So here's some examples in a qualitative study of veterans' unmet needs among a group of Puerto Rican veterans. It included that they had difficulty accessing psychological evaluations, mental health services and support groups, medical evaluations, and treatment for pain disorders. Um, sorry. Sorry, we'll just have to, something just happened with my slides that, I can't, just give me a second, I apologize. In a systemic review in 2014, it was found that Latinx rates of PTSD were higher than non-Latinx veterans.
Malinda, sorry, just to jump in here real quick, make sure that we can see your screen, but we don't see your slides, so you may have to pull them back up.
Okay, sorry, I'm just having issues with.
No, it's okay. Sounds like you might be using your VA computer, and we can all relate to.
I'm using my computer, and
we can all relate to that. So.
It's being very odd. It just you just stop sharing for a minute.
Yeah, you may want to stop sharing and then reshare.
Yeah, I apologize. I don't know what happened.
And if that doesn't work for you, if Jeremy has your slides, we may also transition to you.
Yeah, just give me a second. I'm sorry. Very odd. I really apologize. I'm not sure. Something happened with the.
Jeremy, you have the slides on your end that you could share your screen with?
Yeah, I'm not sure. I don't even know what happened. I apologize.
Dr. Trujillo, do you have the slides in an email, or I'd be happy to pull them up and monitor them for you?
Yeah, let me just try one more thing.
Okay, no problem. I know that how stressful it can be. It really is just a moment. But like certainly anything that I can do to be helpful, I'd be happy to.
Yeah, I think I got it figured out. How is that? Is that fine? Can you?
That's perfect. Yeah, you're on your opening page.
I'm sorry. It just like I couldn't. It switched screens and then I couldn't find you all. So I apologize for the.
I think that happens pretty. That happens pretty frequently, but I'm sorry I couldn't be more help, but it looks like we're good to go.
And then, okay. So with all of this taken into effect, the number of Latinx veterans experiencing physical or emotional injury from military service will increase exponentially in the years to come. Another thing that is more recent to be acknowledged is also race-based stress and trauma. And so not only do Latinx veterans have higher rates of military service, higher rates of combat position, which puts them at greater risk for mental health and physical conditions, lower access to mental health and medical care, but they also contend with race-based stress and trauma while serving in the military. According to a recent study, BIPOC veterans in general are more likely to experience difficulties accessing VA mental health care, to feel unwelcome in VA clinics, and to have worse healthcare experiences for the services that are accessed. For example, in 2017, a study was done on Latinx veterans, and they were less likely to receive psychotherapy in general, much less likely to receive evidence-based care, and if they did receive care, it was group therapy. And also a more recent study done in 2021 of Latinx veterans entering the VA system, following them and other ethnicities. By 6 months after diagnosis, they were not likely to show improvement, and some had worse mental health outcomes. So what I want to talk about is a little bit about military service, because it can be dialectical. So on the one hand, military service can provide social capital, allowing people of color to access education, housing, and in some cases citizenship that may or may not be denied to them based on what systemic racism and oppression. Military service can also foster and promote assimilation, encouraging Latinx folks to take on the dominant culture of patriotism, service, and being white adjacent. And what I mean by white adjacent is that our US military was also founded on Eurocentric values that tend to hone Eurocentric values, ideas of what it means to be an American, what it means to be a service member. They're predominantly based on a white ideal. And so whether it's direct or indirect, there can be pressure to conform to conform to the idealized of a white US military service. It can also be a conduit of depression, focusing on further marginalization and racialized trauma. This presentation specifically is not on race-based stress and trauma, but I can tell you many of my Latinx veterans and other BIPOC veterans, all of them have experienced some form of race-based stress and trauma. It could be to the everyday indignities of what it means to be a BIPOC person in this world, to more overt, such as military sexual trauma or violence because of their race. Also, with that idea of conforming, it can foster a sense of marginalization and the need to conceal one's identity. Another thing that puts people at risk is if you have multiple intersection identities, so you're Latinx and you're queer, they may put you at even greater risk for physical, psychological, or moral injury in relation to your military service. So I talked about it being like a dialectic. What we need to do as VA providers, DoD providers, those serving veterans, active duty veterans, retired veterans, is kind of look at what are our ideas. There's this idea that in order to be patriotic, you should be white, US born, cisgendered male. And that at the same time, although there's a large number of BIPOC folks serving in our US military, for example, with Latinx folks, we're still viewed as foreigners and illegals and a threat to our nation. And so what I might say is calling people in Spanish, it's voces perdidas, is the lost voices. So centering in and calling in our veterans of color, our service members of color, and expanding our idea of what it means to be an American, what it means to be a patriot, that BIPOC folks, immigrants, refugees, LGBTQ+, and other quote unquote outsiders have been essential not only to our nation's security and well-being, but to our nation's history and continued growth. So what I want to talk a little bit is about some social constructs within Latinx culture. And so one of the most predominant language outside of English spoken by Latinxes is Spanish, but not all Latinx folks speak Spanish. And there's numerous dialects within Latinx, within the Latinx diaspora. It's not uncommon for Latinx Americans to speak Spanglish, a mixture of English and Spanish. But what I also want to acknowledge is that within Latinx culture and within the Latinx diaspora, there's many native and indigenous languages that are also included, and that's not often talked about. so here are some possible approaches when it comes to having bilingual patients. I mean, one, first and foremost, you might want to ask them what language do they prefer to have therapy in. Many folks that are veterans may speak English, but also people might be surprised. There are some veterans that don't speak fluent English. I actually worked with military trauma around that. I worked with veterans from World War II, Vietnam, where they were recruited and drafted and did not speak English. So can you imagine being an ethnic minority, being a visible minority, being sent to a war zone, and you can't understand the language that is being spoken when you are in combat? And that's not an uncommon experience. I've also worked with veterans of more modern eras and deployments where this is also an issue, where they might be getting treatment in the language that is not their primary language. And as with language, especially when it comes to the storing of our memories and emotions, it often tends to be more in our native language, or the language that we prefer. So what can happen is there's family as interpreters, bilingual staff. You yourself might get language skills trainings. There's phone-based interpreters, and there's written translations. What I want to say is people may not know this, but the VA does have phone banks. I mean, that's a little bit different for psychotherapy, but they do have phone banks where we can actually get interpreters for our clients. I've worked with many Latinx veterans here out in Portland where all of their providers but me spoke English and no Spanish, and I've had to advocate for them to get not just culturally competent, but linguistically competent services. And so that is one way you might advocate for your clients. I want to talk a little bit about communication within and cultural context within the Latinx community. There's this idea of respeto, which direct translation means respect. That means there's special respect given to our elders and people in authority. So that would also be to providers, mental health providers, medical providers. Also, although there's special respect given, if you're overly familiar and in terms of touch or the way you approach them, that can be considered disrespectful. Another thing that could be possible if folks have a more traditional orientation to this cultural value is that direct eye contact is less common among Latinx folks. And they may also, if they espouse this cultural value, direct disagreement with the provider is uncommon. And so if you just, as a clinician, say you're doing a mental health intake and you just go straight into like, boom, 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 here's our HIPAA, here's all this and that, and just get overly direct, you may not get the best connection with a Latinx client. Like I said, this may not be true of all Latinx clients, but if they do espouse to this cultural value, some of the ways in which we formally tend to assess might not match up with someone who identifies with this Latinx cultural value. There's also this idea of personalismo. It's the tendency of Latinx folks to put more trust in an individual than an institution. So they want to know you, they want to have personal contact with you. If you're impersonal and too formal, it might be a bit of a turnoff. They will vote quality of interaction over quantity. They might expect to be addressed formally, but also expect you to ask them personal questions like how's their family. And so really your personal connection with your Latinx veteran is very important. There's also a construct called simpatia. It is the desire for social interactions to be smooth and polite, avoiding confrontation. So this might be where disagreement may not be considered socially appropriate. And so maybe you're asking your veteran or the client you're working with for feedback, and they don't provide it initially. And it could be with that idea of being polite, having smooth social interactions. They might nod and agree, but they might actually disagree. And so I might encourage you to continue to connect and ask for feedback, and also maybe ask if it might be difficult for them to give you feedback. Modesty and privacy are considered important, and sexuality and trauma might be difficult to discuss, especially with cross-gender providers. So for Latinx women to speak to a male provider about sex, sexuality, and trauma, this could be very difficult, and vice versa for a Latinx male to speak to an opposite gendered provider about sex and trauma. That may be difficult depending on your level of personalismo and connection with them. And so they might be slower to build in terms of doing trauma work in terms of you might take more time in terms of your intakes, in terms of self-disclosure around intimate details, including mental health and physical health. Within Latinx culture, if we have traditional values, we're taught to confide in the family and not to disclose intimate personal details to strangers. So this could come up when you're working with Latinx clients in terms of their socialization, their family connection, their significant others, their children. So it may be slow to build in terms of finding out this information about your clients. And so if you find that they're not directly open, it may not be that they're trying to be difficult. It may be that they take time. They want more of that personal connection before they're going to open up to you. Like I said, sex should not be, sexuality, it'd be difficult to be discussed with the opposite gender or sex. Men may have difficulty expressing emotions and establishing confianza or trust because of shame and machismo, and I'm going to talk a little bit about those things in a minute. So there is this concept of machismo, and what I want to say is it's more nuanced than people think. Oftentimes people have this idea of machismo as a hyper-masculine, very gender stereotypical male, but that's one very pathologized version of machismo. Machismo can be taking on traditional gender roles, like being the breadwinner or being seen as the head of the family, but also within Latinx culture, there is this idea of men being chivalrous, men being leaders, men being a support of the family. There's a sense of honor and self-esteem and manhood that comes from machismo. And so I think we have to be careful about pathologizing a cultural value. We need to both recognize both the positive and negative connotations of this concept. Also, you need to reach out individually to your unique veteran and find out, is this a cultural construct they even identify with? Is this how does it come up with them? How does it apply within their context? But you can see some of the concepts of machismo overlap with the idea of being a man or patriotism within the military. There's also this concept of Marianismo, which comes from the Virgin Mary within Catholic culture and Latinx culture, the all-suffering mother. So it has prescribed roles for women, including enduring hardship and sacrifice and being humble, like being humble, sacrificing, giving, and loving to your family. So it may put a Latina in conflict with more modern values, or like pursuing their own career, or if they become the provider of the family. And they may have different values than you do. You know, I identify as a feminist, but my idea of what it means for my role in my family as a Latina woman or a Latinx woman might be very different from a client who might even have a very similar makeup and background to me. And so we have to be careful not to put our values on other people's experiences, or if we do, own our biases, you know? And so just like with machismo, it can be mixed. You know, their values may be very much different from what you might either consider appropriate or clinically helpful. And so you really need to check in with your Latina and Latinx veterans to find out how and do they prescribe to these different cultural values. And what I will often say is the word machismo is often used in Latinx culture, but Marianismo is less common. But just talking about the idea of traditional gender roles, how is that portrayed in their family? What are their cultural beliefs? What are their spiritual beliefs around that might be helpful. What I want to talk about is immigration. And so one thing that I want to mention is that not all Latinx folks are immigrants. That is also a stereotype that somehow if we're Latinx and we're in the United States, that we immigrated. There are many, many folks who have been here for generations, both those like my family where the borders crossed us historically, and just those that have just been here for generations and generations. So you do not have to always assume that if someone is Latinx, that there is a history of immigration, but there might be a history of immigration. And it's different for different Latinx groups. So you might want to consider nearness to homeland, consider the personal and familial history of immigration. Are they documented versus undocumented? There is a stereotype that most Latinx folks in the United States that immigrated are undocumented. That is not true. Families may have mixed immigration statuses. They might be citizens, residents, documented. And the context of their immigration might change the impact. So if they had to come from, because they were fleeing persecution or escaping violence or economic hardship, or they were forced or by a child, versus a work opportunity, versus very skilled workers might have immigrated to the United States for a different reason, their experiences may be very different. So just like Latinx culture is very nuanced, the history of immigration is also very nuanced. It's important to ask about if there is an immigration history within their family. So what is the impact on immigration on the mental health of Latinx folks? Because of systemic racism oppression, we've seen many of that in the last several years, with the example on the US-Mexico border, with children and families being separated and kept in cages. There is a huge risk for adverse mental health outcomes and race-based stress and trauma and overt trauma. There can be a cultural expectation of rejection from the government agencies, housing, medical, and mental health care. And that is often based in reality, because there's huge disparities in terms of the access to medical, mental health care and housing for Latinxs in general. But if they're an immigrant, that's tenfold. Another idea is concealment, that in order to survive or pass in a Eurocentric American world, that we must conceal our identity to avoid stigma, discrimination, or violence. Or if you're undocumented, I need to conceal my identity to survive, to thrive, to live in the United States. There can be internalized anti-Latinx rhetoric. One of my colleagues calls it defying the lie. So as Latinx folks, we are taught many lies about ourselves, many that I have mentioned, that we don't belong here, that we're not worthy, that we're criminals, that this is not our country, this is not, and you hear those voices for so long, you can take that as part of your identity. You might dissociate from your Latinx or immigrant culture, you might hide it, you might even take on the dialogue of stigma. You can acquire a sense of undeservedness and unbelongingness in the United States. What I want to talk a little bit now is spirituality. Traditionally, many Latinx folks may be Roman Catholic or Christian. However, within that, there's many folk religions, indigenous healers. There's a word called curandera, which is a spiritual and a folk healer that's in many Latinx cultures. Also, there's this extended idea of family. So there's these ideas of comadres y copadres, which means, direct translation, co-mothers, co-fathers, but it can be like your godfather or your godmother, but it means that as Latinxs, our extension of the family system can go well beyond our blood relatives. Also, curanderas and curanderos, our folk healers, can be incorporated in our culture. And also the use of other spiritual healers like priests or pastors or other forms of spiritual healers can be really important. So when you're working with Latinx veterans, you might want to ask, I think all veterans, about spirituality, about spiritual coping, about spiritual beliefs. This is a quote from Lillian Comas Diaz that I think kind of typifies many of these cultural values. As everything is connected to everything else, the Latino world maintains permeable boundaries. For example, because of familismo, boundaries are permeable enough to allow non-biological individuals such as godparents, comadres, copadres, and friends to become family members. Both familismo and personalismo encourage Latinos to perceive health providers as an extended family member. And so your role in a Latinx veteran's life may be considered an extension of family, an extension of trust, an extension of confidence. And there's this interconnectedness. So a few things that I want to talk about with treatment and Latinx folks. Trust needs to be established and needs to be built. One thing that I say is acknowledge your stimulus value, acknowledge your positionality, acknowledge your power and privilege. Don't assume that they're going to bring it up. In fact, I think most BIPOC veterans are not, because of the power differential. So even if you do DEI work, even if you have more of a horizontal way of connecting with your clients, I think it's always important to err on the side of discussion. Another thing is that majority or Eurocentric American culture does not recognize the value and importance of Latinx folks in the past, present, and future of the United States. That is, I mentioned some of that with US military and this idea of, although Latinx veterans have served our country throughout time, being a perpetual outsider, always being on that hyphen, always being on the border, always being told what to do, how to act, and not centering them. As far as treatment modalities, more directive style is favored, seeing the provider as expert. Solution focused, IPT for depression can be important in terms of familismo and personalismo. And CBT has been shown to be very effective amongst Latinx clients, including Latinx veterans, with that idea of familismo and personalismo. Incorporating the family or spiritual providers can be important, as well as spiritual practices. There's also this idea of the connection between the mind, the body, and the spirit within traditional Latinx culture. And so mind-body modalities like relaxation training or mindfulness could be helpful. I also want to tell you, when you're certainly certain that you're certain, seek consultation. So seek out others for if you have questions and concerns. Don't expect your client to be the one to educate you. You need to do your work. Also, keep in mind, like I said, culture is fluid. You might want to, your client's connection to these values or cultural ideas may or may not hold true. So just because maybe you've taken a class or read a book or attended a presentation, these things may not hold true for all Latinx clients. And so you might want to seek out consultation, but do so in a way that centers the people you're consulting with, you know, asking if it's in their bandwidth, asking if they're open to having discussion. And a lot of things, you know, now are on Google. I joke when I do get a lot of DEI questions, some of my colleagues say, go to the church of Google. Like many things, there's so many great resources, especially in the last 5 years, about doing work with BIPOC veterans, BIPOC folks, different affinity groups. So do your own research. Don't expect someone else to do it for you. Make sure to seek consultation when you're selecting interventions and testing. It may also help you assist with questions you might want to ask or more information you may want to gather. Another thing that I also recommend is even as a Latinx provider, when I'm even working with a Latinx veteran, maybe even a Mexican American one like me, I will say things like, hey, there's this idea of marginalismo or personalismo, or there's this idea, I don't know if this fits for you. Does it fit for you? If so, how? You know, and so very much coming from a place of curiosity, acknowledging that this may not even be in their bandwidth or in their idea of culture. That's how I tend to approach these constructs, even when I myself identify as Latinx. So with that, I will stop sharing and open it up to questions.
All right, just as a reminder, if you can use our Q&A feature to help us keep track of any questions that y'all might have. Thank you so much for this wonderful presentation. Lots of different ideas I'm sure that people are really curious about. I know I had a couple of people ask me about Marianismo recently, so all right, I don't see any questions right now. I know we answered one earlier about the slides. So usually with our slides, just as a live announcement, they will be on our Division 18 website along with the recording. Please try to be patient. Sometimes that can take up to a week or two for our admins to put everything up.
I do see that what books and articles, so I do have a pretty robust reference list that will be included in the slides. So I definitely would suggest starting there for sure. So my references will be included in the slides.
You know, just to kind of add on into that question, is there any, book that you feel like would stand out to you as like your #1 recommendation? I know that's a big question.
Well, it's a little bit dated, but it's basically written by some of, I want to call like my godfathers of the field. It is, I'm trying to pull up the jacket because Culturally Responsive Counseling with Latinas, Latinos, published in 2014. But basically some of the people who helped write the multicultural guidelines, and it's been about 20 years ago, APA put out a whole section on working with different ethnically diverse groups, wrote this book. So it's, it could be updated. I also found another recent one that I haven't had the chance to read yet, but I'll have to pull up the reference and send it to you. I can add it. I didn't include it in my presentation, but I would suggest that for sure is Culturally Responsive Counseling with Latinas/Latinos. They haven't have an updated version yet, but that's one of the more comprehensive books about working with Latinx folks for sure.
Awesome. It looks like we do have another question. Can you speak to how acculturation can impact both the mental health of Latinx people and how they may relate to many of the constructs you discussed?
So I think one thing to that idea of living in a perpetual borderland, life on the hyphen, I think other BIPOC folks or people with other marginalized identities get this idea of constantly having to minimize, change ourselves to fit idealized European American cultural values. And so one thing that I think in terms of acculturation is that a constant stressor to be other than who we are. Also, there's a constant stressor of other people, especially dominant culture folks. They get to decide the rules. They get to decide the values. They even try to tell you who you are. Like, for example, with me, I'm a light-skinned Latina. I'm also my mom is European American, but I have people all the time telling me, you're too white to be Latina. You're too this to be that, And so one, I think, cultural variable that I think most people, even if they're more bicultural, like me, and what we mean by bicultural is that they feel empowered in both of their identities, there's still this ongoing stress of being othered, being questioned, being told who you are, being told what the rules are. And so I think that is one thing I will say as far as acculturation goes. I definitely want to say with the military, and I don't think this is just Latina or Latinx veterans, there's this idea that I brought up of being white adjacent. So in order to be accepted by military culture, that we need to minimize, conceal ourselves and espouse and act out the values of the dominant culture to thrive, to survive, sometimes just to be safe. And so that's definitely can be true, I think, in all contexts, but especially within military culture. I would say in academic culture too. So those of you who are supervising BIPOC students, this idea of many of our academic values are based on Eurocentric values about education, about performance. And so constantly this dialect and it can, even for folks who are more acculturated, it can be very difficult. So hopefully that answers that question. I will say in my reference list, they provide, there's an article on the minority stress model as applied to Latinx immigrants. I would highly suggest reading that article because there's some really great expanded ideas on that topic.
So all really wonderful questions, and I do appreciate your answer myself personally. While we're potentially waiting for any other questions, I'm curious if you would suggest anything to any researchers about, the work you're doing, how to, capture different populations within the Latinx communities. Like, what would your recommendation be?
Well, what I would say is do your homework. So I will say I've been giving a version of this presentation off and on since I left grad school about 15 years ago, but and some of them are in my reference list. In the last 5 years, there's been so much more work done on Latinx veterans and like what their unique experiences are. And also BIPOC veterans, there's been a boom about, if you had looked maybe 5-6 years ago, you wouldn't find as much. And so definitely like do your homework, see what's already out there. The other thing, I'm not a researcher myself, but I'm not anti-quantitative methods, but I think that we should consider more qualitative methods as well, like in terms like community-based research, where instead of taking it from the top down, going amongst veterans, Latinx service members, and really using more community-based ways of connecting and centering their needs, and then kind of going top up as far as what research do we want to do, like what do we want to approach, what are their needs, and so hopefully that's helpful.
No, I appreciate the answer. Thank you so much for your presentation. This has been some wonderful information. I know that you are so busy, and I imagine this is a very popular presentation or request. And I know you've already presented for us once, so greatly appreciate it. Edgar, do you have any announcements that you need to make before the end of the webinar?
Yeah, no, not on my end, but I know that Jeremy dropped a lot of important information in terms of housekeeping in the chat. So Jeremy, I don't know if you want to verbally repeat some of that important CEU information, as we often get a lot of questions, and then I'll leave it to you to also highlight the upcoming webinar that we have scheduled for April.
Yeah, not a problem. So I'll start off with the upcoming webinar. So we are having a wonderful presentation on moral injury by Sheila Frankfurt, Ph.D. And she is going to be presenting on April 3rd. Be on the lookout for a flyer for registration within the next few weeks coming out. As always, we do have our presentations on the first Monday of the month at 12 Central Time, unless there's a holiday on that day, in which case we go for the first Friday. As far as, questions regarding CEs, you do have all Division 18 members do get CEs for free. Non-Division 18 members would have had to have paid ahead of the webinar, so before the webinar today, to be eligible for CEs. And you do have to attend for at least 45 minutes in order to be eligible for CEs. If you have met that criteria, there is no need to email us. But if you have questions, of course you can. We do not need you to email us with your attendance. We do get that on Zoom automatically, and we do see how much time you have spent. For people who are calling in not using the Zoom link, again, if you are not using the Zoom link that was sent to you, but you are using a telephone number, please email the division, and the webinar email is on there. And please give us your name and the telephone number you used so we can verify attendance. All of those instructions are very first part of the chat. And that's it for my announcements.
All right, I've got one quick one. I did lie to y'all. I just wanted to give a quick reminder that our next VA section membership meeting, remember we host those quarterly, it will be on April 20th at 3 p.m. Eastern. So for those of you that are members, that invite has already gone out. We'll make sure to send some reminders before that call. It's going to be a really important call just because we've got a lot of great updates for you all regarding our VA section committees and some of the work that they're doing. But it also happens to be Psychology Recognition Week. So I know that VA is doing a lot of work on making sure that we can highlight VA psychologists and the great work that we do. We'll make sure to do the same during our VA section membership meeting. So just wanted to make sure that that is on your radar for April 20th. So Jeremy, that's all I have on my end.
All right, well, again, thank you so much for the presentation. Thank you to our audience for attending. Be on the lookout for more wonderful presentations throughout the year. Bye.